So today I'm going to talk to you a little bit about some of the work that we've been doing in targeted cancer treatment, particularly around these topics of magnetic fluid hyperthermia and ultrasound-mediated therapies. So people usually put the acknowledgement at the end, but this has really been a team effort, so I want to make sure that we recognize everybody on the team. First thing, I'd like to thank the students who have been working on this project, Nathaniel Mosher and Emily Perkins-Harbin. They're doing their research theses right now. Nicholas Winter completed a thesis with us already, and Brandon Aho and Natalie Gerdung have been helping out in the lab. I'd like to thank Robert Cunningham, who's helped out with lab support, particularly with our X-ray diffractometer. There's a whole series of Kettering faculty, Professor Ablau, Professor Tackett, Professor Vaishnava, and also Professor Wang from chemistry. And I'd also like to thank our colleagues in applied biology and chemical engineering for helping out with useful discussions. And we have a whole series of external collaborators as well. Some folks who design magnetic systems from AMF Life Systems and Fluxtrol, Wayne State University. We've been doing some work with them. We have some clinical collaborations with Kellogg Eye Center at the University of Michigan in Ann Arbor, as well as the Insight Institute for Neurosurgery and Neuroscience here in Flint, and Mid-Michigan Health up in Midland. So it's very much an interdisciplinary and team effort to get this kind of work done. So this is probably no surprise to any of you. Cancer remains one of the leading causes of death in the United States. And what may not be so well known, though, is that if you look here, this is a chart from the National Vital Statistics Report, shows death rate per 100,000 as a function of time since about 1958. And what's notable here is that, for example, heart disease, which is the #1 cause of death, has been decreasing, and also stroke, which is this black line right here, has also been decreasing. Cancer has remained relatively constant. There's been a slight decrease since about 1993 in terms of death rate. But still, clearly there's work that remains to be done to improve treatments of cancer. And so there are, the traditional cancer therapies are basically threefold. #1, there's surgery. So in that case, it's usually the first line. If you can do surgery, you'd like to go and you cut the tumor out. Right, and but unfortunately that has its own problems. There's obviously the pain associated with that. It's very invasive, and you have the risk of infection. Another line of defense is chemotherapy. So in chemotherapy, essentially what are more or less systemic poisons are intravenously injected into the body with the hope that they'll kill the cancer cells. That has, of course, well-known side effects as well: nausea, hair loss, and other negative side effects. Finally, radiation therapy is probably the third major treatment. And in that case, again, first of all, it's in and of itself carcinogenic. But beyond that, it also has side effects like anemia, hair loss, nausea, and other things. So we're trying to come up with alternatives that perhaps are better than these existing treatments or could add or supplement these treatments. So in my mind, an ideal cancer treatment would be targeted and non-invasive, ideally. So there's several approaches that are being pursued in this regard by researchers all over. First, I can talk about a little bit what I call chemical or biochemical methods. And these methods, you have some sort of drug which can shown to kill cancer cells, but you attach it to a targeting molecule that specifically binds preferentially to cancer cells. Right? There exist markers on certain cancer cells people have been finding that you can then use to target just those cells. That reduces your side effects. Another approach is what you might call a biological set of methods, or sometimes also called immunotherapy, where basically you take and you try to boost or retrain the immune system to attack the cancer cells. And then a third class, sort of generally calling here physical methods. And in this case, these are methods that use heat, so this is hyperthermia, to try to kill these cancer cells. And those are the methods I'm going to be talking about today, two different approaches to use heat and or targeting of cancer cells. So particularly I'm going to talk about these two that we're interested in. First of all, the magnetic fluid hyperthermia, as I mentioned, and also this ultrasound-mediated therapy near the end. Let's start off with the magnetic fluid hyperthermia. So this picture shows a magnetic fluid. So what this is sort of a black liquid. And when you put a magnet underneath it, you get this sort of spiky looking effect. It's popular at children's museums. And so I'd like to try to explain to you why it is that this particular funny looking fluid might be useful for cancer therapy. First of all, I'd like to show you that it works, at least in a mouse model. It's been shown, and this is a study from 2013 out of a group from Japan, that showed that magnetic fluid hyperthermia could both slow tumor growth and increase survival rates. Let me explain to you what's going on here. So what they do in this experiment is they took some mice and they injected into the mice some tumor cells, right? And they grew tumors on the backs of the mice. Once the tumors got to a certain size, then they injected the mice with this magnetic fluid. Now, this is a special fluid, and it is targeted. So it has some receptors on the surface that preferentially bind, in this case, folate to folate receptors on the surface of the cancer cells. And so it preferentially accumulates in the tumors. And so once that was accumulated in the tumor, then you can see here this is a metal coil around the outside of the mouse. They were able to run an alternating current through that coil, creating an alternating magnetic field. And what happens then is you see here, this is an infrared picture. It shows you temperature. So blue is about 32 degrees, red is 45. You can get the tumor up to around about over 40 degrees Celsius, which is sufficient to start killing those tumor cells. In terms of the outcomes, figure B here shows one measure of an outcome. This is the relative tumor volume versus days after treatment. And so what you see here is in the blue curve, which is no treatment at all, the yellow curve was just the nanoparticles, and green curve was just the magnetic field, you get this rapid growth, an increase of the tumor volume of up to between 50 and 70%. Whereas in the case where the nanoparticles were applied with a magnetic field, you get a much reduced tumor growth. In figure C, you can see then also survival rates. You can see that all the mice that were in the control group died after 8 weeks, whereas the mice in the treated group here lasted for the extension of the study, which was 12 weeks. So clearly, it had a significant effect. All right, so how does this work? And how would you make such a fluid? So I think there's three major properties that you'd like to have for a ferrofluid for bioheating purposes. First of all, you like to have small particles. Second of all, you like to have magnetic particles because you want to use the magnetic field. And third, you want to have some biocompatible particles. So all these things come together to make our magnetic ferrofluid. So let me talk about these in turn. So first of all, small particles. What do I mean by small? And why would we need small particles? So just to give you some sense of how small these are, this is a scale here. This is in nanometers. So you can see here we start off on the right-hand side. We have a tennis ball. It's about 10 to the 8th nanometers. Here's a period at the end of a sentence. That's about 10 to the 6th nanometers. Get down to the size of cells, cancer cells, about 10 to the 4th nanometers. And then you get down to things that affect cells, things like viruses and bacteria and antibodies. And sort of this sort of sweet spot here then is down here, roughly between 10 and 100 nanometers is what most people have been pursuing in the nanotechnology industry. And there's a whole set of things you can make in this range. We're going to be focusing on sort of nanoparticles. And so I think here that not only does it using sort of biological analogies that small things like viruses can affect cells is a compelling reason, but also that these nanoparticles also have interesting properties. For example, when you go down to very, very small particles, these particles have a much higher, say, surface to volume ratio than bulk particles would. And so, for example, then if you heat them up, they're going to rapidly transfer their energy to the surrounding environment, which is what we would want for these cancer treatment applications. So we want small particles. But there are some consequences. What happens then if we make very small particles and they're now magnetic? So let me talk about magnetic particles and what the consequences are. First, I want to take a step back. I know not perhaps everyone is familiar with magnetism on a day-to-day basis or may not have taken Phys 2 yet. So I want to start off. So what's the most common sort of everyday, perhaps, example of a magnet is the compass, right? It's a compass that's two poles. There's a north pole and a south pole. And that, as a result, is called a dipole. Okay? And it turns out that that electrons are basically magnetic dipoles. So they have a so-called spin, which makes them behave in a magnetic fashion. And but I think everyone knows that not all materials have strongly magnetic behavior, right? So let's take, for example, there's a class of materials called paramagnetic materials. In these materials, you have a bunch of electrons, say in the outer shell of your atoms, and each one of them behaves like a little magnet. But because they're all sort of randomly oriented, they don't have a strong magnetic effect. There's only a sort of very weakly magnetic. So what do you have to do to get a more stronger magnetic effect? Well, there's a certain class of materials called ferromagnetic materials, also ferrimagnetic materials, in which case all these dipoles sort of naturally align together. And these then give rise to this you can see sort of when they're all aligned, you get sort of a definitive north pole and definitive south pole. Now, we know that, so iron, of course, is a classic example of a ferromagnetic material. Now, we know that not all pieces of iron are magnetic, and that's because even within, if you have a bulk piece of iron, you're going to have little sections of the material which is oriented like this, but there'll be other sections that are oriented in other directions. And again, the whole net effect will be zero or weak. But if we take these very, very small particles, right, they're so small that it's very easy and energetically favorable for all those dipoles to align, right? And they sort of act like one big dipole, okay? So they call it sort of a colossal dipole here. And so you can think of the whole thing as just like one single magnetic domain. So what are then the consequences of this? So magnetic nanoparticles is not the only place where this comes up. So this is very small size magnets are common in the magnetic hard drive industry, right? So if you want to store information on a hard drive, you can do that by taking a whole little series of these magnets, lining them up, and then if you break your information down into bits, I can say, well, let's suppose magnets that point up represent 1, and magnets that point down represent 0. And then I can store information on the hard drive that way. So, of course, people are very interested in trying to make a high density as possible on these hard drives. So there's been a lot of investigation of what happens when the domains get very, very small. So I'd like to show you this little video clip which explains what happens at that point. It turns out that you get, in these very small domains, they become thermally unstable. So let me play the video, and hopefully that will explain what's going on here. So we see this then, the superparamagnetic effect in these small nanoparticles. Now initially that might seem like a bad idea, because we said we wanted to have something that was magnetic, right? And if these things are flipping around, that's maybe not such a good thing. But one has to think about this. If you put these particles in a fluid, what's going to happen? If I have very strong magnets, right? So suppose these are two little particles, and I pull them together, what's going to happen? They're going to stick together, right? So you're going to get clumping if you have very strongly magnetic particles. And by using these superparamagnetic particles, their time average magnetization, because they're flipping around, is 0. So you'll still get some clumping, but not as much. We'll talk more about clumping in a bit. The other thing I'd like you to take away from this is that it gives you, I think, some intuition about why we want to use oscillating or alternating magnetic fields. If you're going to have these little particles thermally unstable, they flip, then if you use a very low magnetic field strength or a very slowly varying or static magnetic field, you're not going to be able to couple energy very well into these small particles. If instead you can drive your magnetic field at a rapid rate, then that will dominate over the sort of thermal flipping effect, and you can transfer energy into the particles. It's a bit of a hand-waving argument. I'll show you some calculations later to back that up. So we're going to be talking about these superparamagnetic materials going forward here. Now you might ask, well, how do you actually then heat up the particles, right? What causes the heating? And so if I take these particles, I put them in an alternating magnetic field, what can happen? So I have a little illustration here to show this. So on this side, this little video, this side here will indicate the direction of the applied external magnetic field. So in this case, so the magnetic field starts down, and when I run the video, you'll see it'll go to 0, and then it'll flip up, and then it'll go back to 0 and flip down. And I want to show you what happens. There's two possible mechanisms. The first of all, one called magnetic relaxation, one called physical or Brownian relaxation. So let me play the video, and I'll talk about what happens. So in this case, you can see, first of all, in the magnetic relaxation case, you can see the little arrows inside. They're trying to orient themselves with the applied field, right? But the particle itself is not moving. Only the dipoles inside are moving, trying to align themselves with this external field. in the case of the physical Brownian, or Brownian relaxation, you can see the entire particle moves to try to orient the dipoles inside with the field, okay? And then that gives rise, both of these then can give rise to heating. Now, this doesn't take place instantly. Like there's a time delay between when you apply the field and when the response occurs. And that's given by this characteristic relaxation time. And for example, in the magnetic relaxation case, that depends on things like so-called anisotropy, energy density, which basically is a measure of how hard it is to flip the dipoles in a different direction, and the volume of the particle. In the case of the physical relaxation, that depends on things like the viscosity of the fluid and also, again, on the volume of the particle. Okay, so before I go on further, for those of you who may not have seen this before, I wanted to play a little video clip. Magnetic heating can be rapid and dramatic. So what I'm going to show you in this video clip is a metal rod which is placed inside this copper coil. The copper coil will have an alternating current run through it, and you'll see what happens. The magnetic rod does not touch the coil. Right. So it goes from room temperature to, say, well over 1,000 degrees Fahrenheit in a few seconds. It doesn't heat up the coil. It doesn't heat up the coil. Right. So it's rapid and dramatic. Okay? So to be fair, part of this is due to magnetic heating, part of this is also due to eddy current induction, which I'll talk about a little bit later. But it's an impressive effect. So we wanted to make some of these nanoparticles in our lab, and this is how we did it. This is some of Nathaniel's work. So we started off here with iron 3 chloride in an acidic aqueous solution, mixed that with iron 2 chloride, also in acidic aqueous solution. Mix those together under oxygen production, basically run through some nitrogen to keep this from oxidizing. And then you add ammonium hydroxide until you reach about pH 10. And that causes these particles to come out of solution and form iron oxide Fe3O4 nanoparticles. So you get this black fluid like I showed you earlier. That's the basic approach. So, but if we just left it like this, it's not really enough. Like there's another factor here. And this gets back to this idea of biocompatibility. Okay? So we need to do something else to the particles for a couple reasons. First of all, we want to make sure that they don't clump up. And second of all, we want to make sure that they're biocompatible when we put them into the body, so they're not taken away by the immune system rapidly. So there's several different approaches out there in the literature. Some people use PEG, polyethylene glycol. It's kind of pasted on the outside of the particles. And that helps. PEG is well known to be biocompatible. People use surface absorption techniques, where you basically kind of wrap the particle with some long molecules. Or you could use phospholipids as well, so you can sort of, again, form a shell. You can see the commonality between all these strategies. We've typically been using dextrin as a coating. It's kind of a sugar-type polymer. And so the basic procedure there is we start with the nanoparticles on the previous slide. We add the dextrin into solution, typically molecules about 15 to 20 kilodalton in size. We then sonicate, it sort of vigorously mixes the particles up, and it spontaneously sort of wraps the dextran around the particles. And we get our coated particles. And at that point, then if we wanted to, we could then attach other things to those particles like drugs or special targeting molecules. But we haven't done that yet. Okay, so this is the result. This is a transmission electron micrograph of a set of particles. We believe that they're not quite this clumped in solution necessarily. This is part of the preparation procedure for the TEM. But you can see the scale by here is 20 nanometers. The distribution here is shown here. So the mean is about 13 nanometers with some distribution. We are able to use X-ray diffractometry to determine, to verify that this indeed is an iron oxide. You can do that from looking at the position of these peaks. Now, you could ask the question, well, what's going to affect the amount of heating? Right? We want to optimize our heating for our application. And one of the things that affects it, besides the field strength, is the frequency of the applied magnetic field. So this graph shows you, this is some theoretical calculations, of specific loss power. This is basically the energy, the power per unit mass that's absorbed by the fluid as a function of the particle diameter here in nanometers. And this is for Fe3O4. And so the key takeaway point here is that as you increase in frequency, this starts at 200,000 oscillations, 400,000, 700,000, and 1 million, you get an increasing amount of absorption. However, there are some practical limitations. It becomes very difficult to create uniform, high-intensity, rapidly varying fields at higher frequencies. And so typically we're down here in this range between about 200 or 100 and 400 is what our system will do. And that's what most people also do in their systems. So there are some practical limitations. It turns out that the heating mechanism also depends on some various factors, including the size of the particle and the relaxation time. So as I said, when you apply a magnetic field to these particles, there's some time delay between when they respond. And so you can ask, well, which of these mechanisms, the physical one or the magnetic one, is going to dominate? And so you can calculate this out. So you can take these formulas here for the relaxation time, and you can make a graph. So for example, the red curve represents the magnetic mechanism, and the blue curve represents the physical mechanism, which goes kind of as a power law here. And typically, whichever responds faster is the one that's going to dominate. So you can see that the smallest particles, the magnetic mechanism dominates, whereas at the larger particles, the physical mechanism dominates. What's interesting is that where we're at, as you noticed from the previous slide, we're right there, where we get both things going on at the same time. Which then leads to the natural question, which one's going to contribute more to the actual heating? Is it the Brownian, the physical, or the magnetic, the NAL? So this is something we wanted to pursue experimentally in the lab. So here's the setup. So we have basically this is an induction heating system shown here in black. And that consists of an amplification circuit connected to a transformer, to an impedance matching network, which goes into our coil. This is in a cross section. Into that then, that's shown here, the blue coil. Into that is placed our sample. This is in an insulated vial. And into the insulated vial is then placed a thermometer. This is a special fiber optic thermometer. Normal electrical thermocouples don't work because of the highly oscillating magnetic field. So how could we get at this understanding the difference between the two different mechanisms, that's physical and magnetic? Well, one thing we could try to do is, let's suppose we take our ferrofluid and we freeze it, right? If we freeze it, what's going to happen to the physical mechanism? Those particles aren't going to be able to move anymore, right? They're not going to be able to physically rotate. So that way we can isolate the magnetic mechanism and then deduce the physical mechanism. So that was the strategy. So we basically used liquid nitrogen to freeze the ferrofluid and did some measurements of the heating. So this shows some results of this. So here we see, you can see you can get it down to very low temperatures. We started, I think we got down as far low as negative 140 degrees Celsius, started taking data about negative 110. And you can see over a period of a minute to minute and a half, you can get a change of about 70 degrees Celsius. Right? So it's fairly rapid. As we predicted from the theory, the heating is faster if you go to a higher frequency. Now, we don't have, what we're really trying to get to is what's called the specific absorption rate, which is the energy per unit mass. But there's a complicating factor here, and is that we don't have a perfectly insulating environment, right? We insulate some, but it's not perfect. So we get some heating just due to if we turn off the magnetic field, you see there's some ambient heating. We get about 20 degrees of heating simply just because from the outside environment absorbing into the sample. But you can compensate for that and using these formulas here, and you can come up with sort of an overall effective absorption rate. And what we find is that the heating per unit mass shows a distinct temperature dependence over this range. So here you see there's about a 20% decrease in this absorption rate over this period in temperature, and at 150 kilohertz, and about 10% decrease over for the higher frequency. So this data analysis experiments are still ongoing. We're going to try to tease out this distinction between the fluid and the solid in terms of the mechanisms involved. So hopefully, by this point, I've convinced you that magnetic particles work and that you have some idea about how they work. And the next question is, well, can you do this in humans, right? I showed you could do it in mice. It's great if you're a mouse, okay? But can you do this in humans? So there have been some limited clinical trials, okay? Perhaps the most extensive work's been done in Germany, which showed that magnetic fluid hyperthermia plus radiotherapy, so using the two in conjunction, has extended the survival for brain cancer patients, okay? We're particularly interested in brain cancer. We have a local collaborator that we're hoping to start some clinical work very soon. We have a patient lined up. And here's the basic setup for this study. So they were looking at glioblastoma. Glioblastoma is a very aggressive sort of brain cancer. Time from diagnosis to death is typically about 12 to 15 months. Very aggressive, hard to treat. When the tumor grows, it grows off in sort of many different directions, and even if you are able to resect it, it's hard to get all of it. This shows you an MRI, preoperative MRI for one of these patients. This particular study was focusing on patients that already had a recurrence. Okay, so their prognosis was already not so great. What they did is they used a needle to inject nanoparticles into the area of the tumor. You can see that here. This is in the post-op MRI. You can see this sort of bright area here. That represents the nanoparticles. And then they did the heating with a special device that they developed at their company and see, well, how does that affect the outcomes? And you can see here, post-recurrent survival increased from about 6 months to about 13 months. Okay, so it's not a cure, but 7 months is 7 months if you have cancer. So, this is early stage technology, and I think definitely can be improved. We're also interested in some work. We've been, like I said, did a collaboration with folks down in the University of Michigan Kellogg Eye Center. They're interested in eye cancers. And so we've done some preclinical work in this regard with regards to retinoblastoma. So retinoblastoma is a cancer of the retina. It unfortunately affects primarily children under the age of 6. And it's typically not fatal, but it can definitely result in loss of vision. So there's a need for improved therapy in that regard as well. So we've done some in vitro testing, took some cultured human retinoblastoma cells, and we're able to show that in about 3 minutes of exposure, we could get about a 90% death rate for the cells in culture. And we're hoping to start some animal studies with this approach very soon. So there are some promising paths forward to apply this in the clinic. However, there are challenges that also remain. As I mentioned previously, you can get so-called eddy current heating. So the idea of the magnetic fluid hyperthermia is that you only heat right where the nanoparticles are. But that only works if you're in a non-conducting medium. And the human body is conducting. It's basically kind of a saltwater gel. You can get then, for those of you who are taking Phys 2, this is sort of Lenz's law, right? You get induced currents, right? If you're studying for finals, it's coming up. You should know this. You can get these induced currents, and those currents can cause heating as well, outside of the area where the nanoparticles were applied. And so you need to be careful about what you're doing when you're designing these systems. The other thing that you might consider is, what about safety and elimination of these particles? You inject these particles in, what happens to them afterwards? This is some results from a study that was done in mice, again, using different concentrations of these radio-labeled nanoparticles so they could figure out where they went. And what's interesting is you see that some did go to the tumor, but a lot also went to the liver and to the spleen, right, which is sort of the natural filtration systems for the body. And so you can ask the question, what effect does that have on the body over the long term if they remain in the liver or they remain in the spleen? Are there other long-term side effects? I think that remains to be explored. And finally, there's issues of delivery and uptake, right? Just because I inject the nanoparticles in or somehow try to get them in intravenously, does that mean they're going to go where we want them to go? So here's an example of a study that was done where they actually had, this is electron micrograph, and you see cells here and here and here, and the nanoparticles sort of in between the cells. And that might be good enough. But if you want them in the cells, you may have to do something else. Right? There are other studies that show that they do get inside the particle. So it may depend on how you coat the particles or other things like that. Okay, so there are still challenges that remain. But we're hopeful. I want to talk a little bit about ultrasound-mediated therapy as well. I think it's also a promising direction that I have interest in. And so let me talk about what that means. So the claim I'd like to make here is that ultrasound-stimulated microbubbles can induce cell poration, and that can be a mechanism for drug delivery, okay, targeted drug delivery. Let me explain how that might work. So first of all, a little review. What is ultrasound? Well, ultrasound is basically sound that exists at high frequency. Sound is basically pressure oscillations in a fluid. So this little illustration shows that here. If I have some sort of transducer or piston which is oscillating on one end, that's going to create regions of compression and rarefaction in the fluid. Okay? Imagine these are little water molecules. And so if I have this situation, and now suppose I have a little bubble, and I put it into the fluid. Well, what's going to happen? In the regions where I get compression, the bubble is going to shrink. In the regions where I have rarefaction, the bubble is going to expand. And so what I'll end up with is a oscillating microbubble. In this case, you can make these bubbles about a micron in size, and that's small enough to get them through the bloodstream. Incidentally, these oscillate about 1 million times per second, so you have to have a very special camera to take pictures that fast. Okay, so now suppose we take that same bubble and we put it next to a cell. Okay, what's going to happen? Well, put the bubble next to the cell. As the cell oscillates, it's going to jostle the fluid around it, and that sort of poking in the cell, it's been shown that alone can actually just open up the cell membrane to let small molecules in. But you can do more than that. Suppose we sort of crank up the volume a little bit on the sound, and what's going to happen? Well, we can collapse the bubble. So if you can imagine the bubbles like this, it will kind of collapse in and on itself, creating a high-speed jet. You can barely see it here, high-speed jet that comes in, and that can porate the cell, open up the cell. And then hopefully then we can get our drugs in through that pathway. So that would be the idea. That's called sonoporation. So the sort of overall mechanism then would be identify the region of your tumor, inject these microbubbles, suppose you can even load them up with some drugs. Then you could even though they'll go everywhere in the body, you only activate them at the point where the tumor is. You can put the ultrasound transducer rest where the tumor is, and you only do the drug delivery there. So that gives you control in both space and time about the delivery of the drug. That would be ideal for a lot of circumstances. So is it possible to do this sort of thing in practice? So I'd like to show you here an example of a study that was done again in mice. This is for skin cancer chemotherapy, where they basically used ultrasound and bubbles. So let me explain. So what they did here again is they injected some tumor cells into the eyelid. These are melanoma cells into the eyelid of these mice, and then treated the tumors with this drug called bleomycin. And what's interesting here is you can see here, this graph shows the relative tumor weight as a function of time. This is in days. And what you see is that in the control case, you have no tumor suppression. It grows basically exponentially. If you introduce a drug at increasing concentrations, you get decrease in the tumor size. Okay, that's what we expect. It's a chemotherapeutic drug. But in all the cases you see here, none of them actually reduce the tumor back down to the original size. Okay? Now, in the treatment group, they introduced both the bleomycin and the ultrasound and the microbubbles. And what you see is that in some cases there was a transient increase in the growth, but then a fall off, or in some cases just a complete fall off. Right? And what's also interesting about this is that they're using lower concentrations of the drug and get better results. We had this idea that we could maybe come up with a hybrid method where we could combine some of the properties of the magnetic nanoparticles with the microbubbles. And so this is some of the work that Emily Perkins-Harvin's been working on. Here's the basic idea. Let's take the nanoparticles that we have. This time, instead of coating them with dextrin, we coat them with oleic acid. Oleic acid is a hydrophobic molecule. That turns out to work better with the kind of surfactant we want to put around our bubble to help stabilize it. In this case, we use phosphatidylcholine, which is a fatty acid. And so we take the nanoparticles with our surfactant. We then sonicate them with this probe sonicator, mixing them with air. And spontaneously, you get these bubbles. And you can see they sort of have that characteristic color of the ferrofluid in them. And what we think is happening is that the iron oxide particles are being sort of embedded then in this lipid shell around a gas core. We know that they're magnetic because we can put them on a microscope slide. If you take a drop it on the microscope slide here, then you can put a magnet by them. And what we find is if we don't add the nanoparticles to the bubbles, you get just a sort of random distribution of the bubbles. But if you put the nanoparticles in, they sort of tend to align in the direction along the lines of the magnetic field. So that's an interesting positive result. So we're still working on this, trying to move toward a clinical application. Here's one possibility in that regard. There's been some other work done that's shown that, again, in the brain cancer and brain disease arena, that you can use this approach of using ultrasound and microbubbles to transiently open the blood-brain barrier. Okay? So what does that mean? So your brain has sort of a natural set of defense mechanisms that keep out undesirable molecules, okay? Only lets the things it wants in to pass, right? Things like glucose. But there are cases where you'd want to get drugs in, okay? And they may be stopped by this blood-brain barrier. So if you could transiently open that barrier, then you could get those drugs in, and hopefully the barrier will reseal itself. So in this experiment, what they did is they had, in this case, a rabbit, and they did a partial skull removal, and then they used a ultrasound transducer and were able to focus it into the brain. And they then injected the rabbits with intravenous intravenous microbubbles, and then exposed the brain to the ultrasound. And here they also introduced some agents which would normally not be able to get into the brain. So in this case, this is a gadolinium compound, which is normally impermeable, and also they introduced a blue dye. And what you see here is where they had the focuses of the ultrasound, you get uptake of the gadolinium. In the MRI, this is while the animal's still alive, they then sacrifice the animal. Here you can see sort of the cross-section of the same plane. You can see the uptake of the blue dye in those same locations. So clearly there's been some compromise of the blood-brain barrier. And other studies have shown that it's not permanent. It can actually reseal itself. So we think this might be a nice way if we can combine the magnetic microbubbles with this sort of kind of approach. We might be able to do enhanced therapy. OK, so just to close then, we believe that magnetic fluid hyperthermia and ultrasound-mediated therapy have the potential to improve upon current methods of cancer treatment, for the reasons I've discussed. The basic idea is that if we can get these sort of targeted therapies, we can get fewer side effects, better drug efficacy, or treatment efficacy, and that'll lead to improved patient outcomes. So with that, I think I'd just like to acknowledge our sponsors here for all the work to help our students go to conferences and pay for some of the research. It's been really, really helpful. And if there's any questions, I'll be happy to take them at this point in time. Thanks. Proton therapy. So proton therapy is a form of radiation therapy, and that can have this sort of carcinogenic side effects that we wouldn't see here necessarily. The big advantage of proton therapy over regular radiation therapy is that it doesn't penetrate much beyond a certain distance, and so it can be much more targeted. So it's often used for pediatric cancer treatments in that regard. So, but the mechanisms are completely different. So in proton therapy, you're actually doing damage to the DNA, and that causes the cells to die. Here, it's the heating that causes the cells to die. That's the biggest difference.
In terms of collateral damage, from the little reading that I read, was that it actually the cell damage at entry and then beyond.
Right, that's true.
How does that compare to the...
Well, here the so-called collateral damage would be due to heating outside of the regions where the nanoparticles would be, or outside. I didn't mention, but you can also do heating with focused ultrasound. And so you have to control the heating, and that's key. So there's a potential there also but you can get very, I mean, these are very, it basically has to do with how finely you can inject your fluid, or how finely you can focus your ultrasound. So that's going to be in the order of millimeters.
Yeah, one of the studies that you had up there was the glioblastoma Germany, and do you know how many patients were in there?
So that was a phase 2 clinical trial. I believe they're on the order of 69 patients. Yeah. No, 69, roughly 70 patients. Yeah. Yeah.
Can you describe what mechanisms you're looking at to physically locate if you're infusing them? That's a fairly crude delivery system.
Sure.
Well, one of the nice things about these nanoparticles is that they're what are sometimes called a theranostic agent, and then in the sense that you can use them for therapy, but you can also use them for diagnostics in the sense that the iron shows up very well, as I showed on the MRI images. So you can use MRI as a way to visualize the location of the nanoparticles. So that would be my, does that make sense?
It does. I'm curious if you're trying to use any sort of magnetic mechanism, to use a crude word, to physically locate them.
Sure.
Yeah, there's been some thought of using an applied magnet to sort of try to concentrate. I've seen at least one study in mice where they put a magnet on one side of the brain and no magnet on the other side, and they were able to get more accumulation in the side with the magnet. So that, I don't know. It may be hard to implement in practice, especially for a larger human, but it's an interesting idea, definitely.